Stakeholders in the Nigeria Tobacco Control Alliance (NTCA) have called on the federal government and other stakeholders charged with the responsibility of ensuring a tobacco-free Nigeria to ensure the speedy implementation of the new graphic health warnings on all tobacco products in the country so as to reduce its daunting effects on the health of Nigerians. They made the call at a press briefing this Monday in Abuja. Clearview's correspondent has the details.
In 2021, the federal government directed all tobacco companies doing business in Nigeria to replace tobacco products with colorful and appealing packs to the new ones with graphic health warnings prescribed by the Federal Ministry of Health. The messages on the new packs are required to be more precise, with full-colored graphic images and warnings covering 50% of the principal area, replacing the former mandate, which states that the Federal Ministry of Health warns that smokers are liable to die young. The policy is in line with directives of Nigeria's National Tobacco Act 2015 and the National Tobacco Control Regulations 2019 as prescribed by the World Health Organization Framework Convention on Tobacco Regulations and serves to expose the harmful effects of tobacco use on public health. In line with the provisions for the effective implementation of the policy, Section 20, Subsection 3 of the policy also states that the graphic health warnings and messages be changed within 2 years to new ones as prescribed by the Ministry of Health so as to keep the shock value high for Nigerians. However, over 2 years after the first phase of the implementation, stakeholders in the Nigeria Tobacco Control Alliance at a press briefing say producers of tobacco products are yet to comply with the second phase of the new graphic warnings and messages as prescribed by the Ministry of Health.
The first set of warning, a contrast image of healthy lungs and diseased lungs of a smoker, was issued on June 23, 2021. And it has expired on June 22, 2023, after a period of 2 years. It is now 1 month since the warnings expired, and as an alliance, we alerted our members in the FCT, Ebonyi, Kano, and Lagos states to monitor compliance because by now we expect that new warnings will be on the tobacco packs. And it is shocking to reveal that compliance to a new warning is a flat 0%. This is totally unacceptable, and we think we should raise this alarm and that the tobacco industry should not undermine the laws governing, the tobacco business in Nigeria.
So our kids are very vulnerable. It is our responsibility to protect them. It is our responsibility to go out there and sound the alarm. And also, of course, we continue to call on the government agencies, starting with the Federal Ministry of Health, who actually had issued these warnings and said, okay, you need to do this by this date, but tobacco companies haven't done nothing. So what is the government going to do? The Federal Ministry of Health is one, Standards Organization of Nigeria is another, and also the Federal Competition and Consumer Protection Council and other agencies. This is a multi-sectorial issue, but these are the lead agencies we would like to call out today because this is very serious.
In Senegal's graphic health warning is 70% of the graphic health warning of the principal display area, front and back. And it's to be rotated every year. It's 12 months. Nigeria is at 50% and to be rotated every 2 years. There are countries where 2 health warnings run simultaneously. So we're not asking, as a matter of fact, Nigeria's law is too liberal to the tobacco industry. I do not expect that they need to be reminded to implement. And it all comes back to the government. It all comes back to the agencies of government. What are they doing? And we are calling on the agencies of government concerned, customs, to stop importation, to stop allowing the importation of products that do not comply with the current health warning.
We are relying on you to help us to amplify this message that government, it's time for us to start the implementation of the second set, because after this one there should be other ones that should be coming out to help the people to stop smoking.
The tobacco epidemic remains one of the biggest public health threats the world has ever faced, killing more than 8 million people a year around the world and 28,000 annual deaths in Nigeria. It is believed that the introduction of graphic health warnings is an effective way to reduce its consumption and associated harms. It is therefore necessary for stakeholders to ensure its implementation on all tobacco products in the country.